Did Hugo Chavez improve healthcare in Venezuela? Have you ever wondered how a leader's vision can reshape an entire nation's healthcare system? Let's take a closer look at Hugo Chavez and his impact on healthcare in Venezuela. During his presidency, Chavez made significant changes aimed at improving healthcare, all framed within his socialist agenda. This approach was closely aligned with the principles of communism in Latin America, emphasizing state control and social welfare. In 2003, Chavez brokered a notable agreement with Cuba. This deal involved exchanging Venezuelan oil for Cuban doctors. Thousands of Cuban medical professionals came to work in underserved areas, especially in poor neighborhoods and rural communities. This initiative greatly expanded access to healthcare services for many who previously had little to no options. Chavez's government more than doubled its spending on health and education. This increase was made possible by state control over the oil sector and high oil revenues during the early 2000 years. As a result, numerous medical clinics were established in working-class barrios and slums. This dramatically improved healthcare availability for the poor. Statistically, these healthcare reforms contributed to a significant reduction in poverty and improvements in public health indicators. From 1997 to 2011, the percentage of Venezuelans living in moderate poverty dropped from 54% to 31%. Extreme poverty fell from 23% to 9%. Illiteracy rates also declined, and access to medical care became more widespread. From a communist perspective, Chavez's healthcare improvements can be seen as part of a broader effort to challenge capitalist structures. He prioritized social welfare and redistributed resources to marginalized populations. His policies aimed to provide universal access to essential services like healthcare, reducing inequality and empowering the working class. However, some critiques argue that Chavez's model was more state capitalism than true socialism. It maintained capitalist economic structures while expanding social programs. Yet, within the context of Latin American communism, Chavez's healthcare policies represented a significant step towards socializing medicine. In practical terms, Chavez's healthcare reforms involved importing Cuban medical expertise, increasing government health expenditure funded by oil revenues, and establishing community-based clinics to serve poor and rural populations. These measures reflected a concrete application of communist principles in Latin America. They demonstrate how socialist-oriented leadership can prioritize health as a fundamental human right and a tool for social transformation. So, did Hugo Chavez improve health care in Venezuela? The evidence suggests that he did make notable strides in expanding access and improving health outcomes for many Venezuelans.